Ahead of the president's event at that church today, the mayor of Phoenix, Kate Gallego, issued a statement warning about the dangers posed by hosting this event, given what else is going on in Phoenix and Arizona. She said, quote, "While I do not believe an event of this magnitude can be held safely, particularly as Arizona sees rising COVID cases, the president has decided to continue with this rally." She noted that the event was not permitted by the city whatsoever. White House just went ahead with it. Quote, "We've seen tremendous compliance with the mask ordinance that went into effect in Phoenix this weekend. Everyone attending the president's event, particularly any elected official, should set an example to residents by wearing a mask. This includes the president. Public health is a group effort, not a partisan issue. It requires the participation of every resident and level of government." Despite that strong appeal to public health, it appears that the vast majority of attendees at the president's event tonight weren't wearing masks, let alone him. Even as 3,000 people sat crammed together at this long indoor event. With coronavirus cases in the state of Arizona hitting record highs every single day now, and with hospitals and ICUs reaching capacity, how potentially consequential is an event like this one? Especially if you're a frontline health worker who has been dealing with this crisis each and every day. Joining us now is Dr. Mortaza Akhter. He's a clinical assistant professor of emergency medicine at the University of Arizona College of Medicine in Phoenix. He's currently working at 2 different ERs in the Phoenix area. Doctor, it's a real pleasure to have you here. Thank you so much for making time.
Thank you for having me back, Rachel. I appreciate it.
You were here about a week ago, and one of the things that you expressed was concern that you felt that the numbers, as bad as they are and as bad as they look in Arizona, might not reflect how bad the epidemic is, just given the flow through of patients that you're seeing in emergency rooms. A week after you expressed those concerns here, are those concerns at all alleviated? Have things gotten any better?
No. For anybody who's saying things are better, they can come to my shift right now, which I just asked a colleague to cover me for so I could be on this interview. It's not better. And if anything, the state data seemed to have basically backed up what I was seeing. I was hoping that maybe I was wrong and I was just at the wrong spot at the wrong time. But the numbers are only going up, and the positivity fraction is going up dramatically. People keep saying if you test more, you have more positive cases. Well, you also have more negative cases. So the fact that the positive fraction is going up so rapidly is concerning. And what's even more concerning is they're not even going to decompensate until a couple of weeks from now. So as bad as it is now, I'm concerned about what a couple of weeks from now will bring. And then you've got this rally you were talking about, which I think is going to be a hot spot for spread. Who knows what's going to happen?
In terms of the impact on Arizona, we're starting to see testimonials in particular from nurses, but also some doctors in Arizona, where people are talking about real exhaustion and just the toll of working in totally full units with very sick people, totally full intensive care environments with very, very sick people, with lots of patients dying, with lots of I guess, whatever the opposite of turnover and people coming into the hospital, staying there for a long time and not seeing good outcomes and getting out. Is that your experience in Phoenix? Are you worried about health workers being able to, health workers and health infrastructure being able to keep up?
Oh, totally. I think I'm in a very lucky position, actually, because I work at a safety net hospital where I've got some of the best residents I've ever worked with working here. They've got a lot of energy, very positive attitude, and it's an honor to be next to them. But very few people are that lucky. All the departments are backing up. If an ICU fills up, it has a domino effect in every department below. And then we end up stacking those patients in the emergency department. That's a very concerning situation because you have COVID patients and non-COVID patients all within the same department. And we're trying to separate them, but it's an ER. There's only so much we can do. And so, as you can imagine, it starts taking a toll on people because not only is there a volume, you also have to prevent yourself from getting sick and also prevent infecting others. It's a tenuous situation.
I'm worried about what's happening in the Southwest broadly. I mean, when we first saw the regional hospital in Yuma, for example, Yuma, Arizona, getting overwhelmed, one of the things that doctors there told us is that the relief valves, that they were able to transfer other patients to other places in Arizona that weren't being hit as hard. Well, we're now seeing all the population centers in Arizona being hit hard. We're hearing about strains in the hospital systems in all different parts of the state. But we're also seeing that even in neighboring neighboring states, certainly the parts of California that neighbor Arizona. I mean, Utah is having serious spikes. Nevada's numbers are really starting to climb. We've seen terrible numbers in New Mexico, and even a state over in Texas. We're now seeing them hit records every day. I'm starting to worry that this kind of flex in the system won't be there when individual hospitals say we can't do it, we can't take another patient, that there won't be places even nearby neighboring counties or even neighboring states to send anyone.
That's a really great point for a couple of reasons. One is note that means the coronavirus doesn't know state borders or city borders. So when people talk about, well, will the mayors decide in this ardent expression of federalism, well, coronavirus doesn't know that this city has a mask policy and this city doesn't. Those people congregate with each other and the virus spreads beyond any border that exists. And you can see that with how much of the Southwest is getting hit. We currently in the state of Arizona have a surge line, which is a really nice perk, if I may use that word, such that if your hospital is filled up, you can call the surge line to transfer a COVID patient. And so far, that's been working okay, so far. Now, that applies for COVID patients. If you can imagine, there are people who don't have COVID who are also very sick and need an ICU. And those patients really are stuck because if your non-COVID ICU is full, good luck getting that patient transferred. And like I said, we're not even at the peak. I think it's only going to get worse from here. And that's what's concerning.
Dr. Mortaza Akhter, clinical assistant professor of emergency medicine at University of Arizona College of Medicine in Phoenix, working 2 ERs in Phoenix right now, taking time out of his shift in order to be here with us. Thank you for doing that. Thank you for helping us understand what's going on. Keep us apprised. We're really worried about Arizona. Tonight's event notwithstanding, we're worried about you. So please keep us apprised, Doctor.
Well, thank you, Rachel. Thank you for spreading the message and stay safe.
You too. Thank you, sir.